Hi, I'm Dr. Jonathan Pontell, and we're going to be talking about facelifts today. So we do two different kinds of facelifts. We do mini facelifts and what we call a traditional facelift. The mini facelift is a smaller operation that can be done in the office under local anesthesia. Some patients want to do it that way. Some patients would rather go to the surgery center and go to sleep, but either way is an option. But it's a smaller procedure with a quicker recovery time. Candidates for a mini facelift tend to be younger, but it's not necessarily true. We have patients who are in their 60s and even 70s who have minimal aging in their neck, where they don't have muscles that are very loose or a big, heavy, fatty collection in the neck. And those patients can be excellent candidates for a mini facelift. For a mini facelift in the office, the patient comes in, we do topical numbing, which means we put numbing cream on their face for about 45 minutes. We remove that numbing cream and then we mark the patient out and we do local anesthesia injections. That's the one part of the surgery where there's some discomfort. Once the patient's numbed up, it does not hurt at all. And it takes about 2 hours for a mini facelift. We see patients the next day after surgery, change the dressing, and then we start taking sutures out 10 days after surgery. Downtime for a mini facelift, we tell patients don't make any big plans for 2 weeks after surgery. Black and blue after surgery is reality, but most patients don't have significant black and blue. But many patients with a mini facelift can have their hair down and they could be out and around, say, 4 or 5 days after surgery. The other kind of facelift that we do is called a traditional facelift, and that it's similar to a mini facelift in the cheeks, but the difference is when a patient has a heavy neck, a full neck, a neck with very loose muscles, that requires this procedure that's a little bit more involved, where there's an incision under the chin that allows us to go and address the issues in that heavy neck. For the traditional facelift, that we do at the surgery center with the patient either under sedation anesthesia or general anesthesia. The actual surgery takes about 2.5 to 3 hours. Just like with the mini facelift, we see the patient the next day, change the dressing, and then 10 days after surgery, remove sutures. With the traditional facelift, there tends to be a bit more black and blue, and we tell patients 2 weeks. Don't make any big plans for 2 weeks. The results after a mini facelift or a traditional facelift, they're really seen immediately. The next day when we change the dressing, you're not looking at the final result. All the healing hasn't occurred, but you're seeing the jowls lifted, you're seeing the neck lifted, you're seeing a crisper jawline. We do everything we can to have the most natural appearing result. A lot of patients are concerned that they're going to look pulled or distorted or different, and we do surgery that I think is very effective, but it's not going to change the way someone looks. It's not going to look like a different person. They're just going to look refreshed, rejuvenated. A lot of patients say that people aren't asking them, where they had a facelift. They're just saying, you look good, and they don't really know why. So yes, with any surgical procedure, there are potential complications. Thankfully, they're incredibly rare, and if a complication does occur, we have the ability to address it and take care of it. When we're doing a facelift, obviously a person is concerned about the appearance of their face and their aging, and we look at other parts of the face as well. So an eyelid lift and a brow lift are other procedures that are often done in conjunction with a facelift. The vast majority of patients are very happy with their facelift results. I often hear that patients say they wish they had done it sooner. Patients tell me that they feel that they look like the same person, but just refreshed and rejuvenated, and that's what we love to hear. I have this one patient who had a very, very heavy neck, an incredibly full neck. Basically, her neck went from her chin to her chest, and she was very self-conscious about that and just wasn't feeling good about herself. And we did a traditional facelift, and the results were dramatic. And it really made a significant change in how she felt about herself. It really changed her life. She came back and just said exactly that it changed her life. And that makes us feel really good. So for anybody interested in a facelift, it makes sense to come in for a consultation. During the consultation, we show you many before and after pictures of other patients, we do an exam, and we figure out which procedure makes the most sense for you, and we answer any questions that you have so that you're completely comfortable with your decision.